I think Professor Kress will say some short remarks and introduce Ministry of Health. Or I can do this. Okay, it's my pleasure. The Ministry of Health from Spain, Sonia García de San José. Thank you.
Thank you very much for inviting the Health Ministry to tell you our modest contribution to this fantastic forum that has been working to improve pain and the attention to patients with pain in the framework of Europe. First of all, I'd like you to see me as a politician, even though my position is not as a politician, because I'm just below the level of politicians. After the debate that we've had before with the indicators, I would like you to see me as a politician that needs to work towards the improvement of patients' treatment, and how a politician can make these improvements.
Pequeños problemas y ajustes.
There are little technical problems.
Pain in the strategy of... Pain. No, eso no es. Lo he visto antes. ¿Dónde está? A ver, antes cuando estabas en la primera. Copias. A ver, baja. Empieza por pain. Con pain. ¿Pasos? ¿Este es tuyo? No, no es mío. ¿Dónde es tuyo? Me mandé un correo. Vale. Aquí. Ahí. Discute. Nada. Bueno, después de este...
Well,
ajuste, ¿no?
after this little technical glitch, as I said, I would like you to consider me as a politician to whom you need to sell the idea to improve the treatment of patients with pain. We have to focus on chronic pain, but we don't have to forget also the other patients. We have to see how the national health system responded to the challenge of chronicity. In Spain, we've worked on strategies, plans and programs in the regions, and we also developed specific plans for chronic diseases, like the plan that we adopted last year, and other chronic disease like diabetes and others. Since 2006, we considered that we needed a national strategy to work on the complexity of chronicity in the national health system. This strategy, signed by all the officials last year, was drafted not for a specific disease, but for all the health conditions and chronic limitations of activity. So we do focus also on chronic pain. We had a multidisciplinary focus. We had physicians and nurses who worked in the coordination of such a strategy. And together with this, we had a plan to facilitate its implementation in the regions. We have to say that in Spain, we have regions or autonomous regions with a very specific strategy for chronicity. We have some regions that are here that have developed their strategies towards patients with pains, Catalonia, Galicia, but the situation depends on the regions. And as a ministry, our mission was to have a cohesive national system. Some of the regions that were working in the improvement of the chronic patients had to go forward with the plans, but at the same time, some of the regions that were not so developed on this issue, we had to push them so that they could start designing their programs or could start working in their attention towards chronicity. And this is also applied in the attention to patients with chronic pain. Before I've said, and we've discussed whether it was important to have a national strategy regarding chronic pain. In my opinion, it is necessary for the reasons that I've just stated. If these issues are not dealt with at a political level, nothing is done. If there wasn't a strategy, a national strategy in Spain, and we have all the officials that work on health in the different regions, well, the regions wouldn't be drafting right now their attention plans towards chronic patients. And we would have the same problem for chronic pain. If we can't discuss on documents, if we can't establish minimum standards, if we can't establish recommendations to improve the life of these patients, certainly we would have regions or autonomous regions or countries even that would not start working on this issue. Therefore, this is extremely important. Obviously, this doesn't mean that we will have good indicators of result in all the aspects, but we need to have a political discussion on this. All the plans drafted in the national health system, we have committees with the autonomous regions, with the Ministry of Health and other ministries that are competent on this. And we also have the technical committees with the scientific societies. Regarding chronicity attention, we have 22 scientific societies, 5 associations of patients, and 5 experts, external experts to chronic patients. It wasn't a plan that was drafted from the ministry. It was a plan that was designed by everybody, by the regions, by the scientific societies, and by the patients. Let's see now the guiding principles regarding the attention to chronicity in the national health system. These guiding principles can be applied to patients with chronic pain. The person is the center of the system, and in this we have to take into account the private and social sphere. Secondly, we have to put forward recommendations regarding the life cycle and also take into account the social determinants of health. And thirdly, we have to consider all health conditions and chronic limitations of activity. And pain is a limitation of activity. We also consider that to take care of any patient with chronic pain, the patient needs to be at the core of it and needs to be at the core of the primary care. We have to guarantee the continuity of care to avoid fragmentation, duplicity, and misunderstandings between the systems, And health professionals and patients need to be accountable regarding a good use of the health system. And we also have to take into account the social services, and both are accountable, the professionals and the patients. Once we've drafted the chronicity strategy, we just focus on patients with chronic pain. And what we're doing now is drafting a national plan with patients with chronic or acute pain. But for the chronic pain, we will follow the strategy of attention to chronicity. And this is similar to the improvement of health of those patients. We have in this strategy health promotion, prevention of health conditions and limitation, continuous care, healthcare reorientation, health equity and equal treatment, and innovation and research. So we have 20 objectives and 101 recommendations. Many of those recommendations can be applied in the attention to patients with chronic pain. In the health promotion objective, where we have the three main objectives, we need to have an intersectoral approach. As we've said it here, it's important that in the health promotion to adopt an intersectoral approach. We have work, industry, etc. And all this is related with the attention to patients with chronic pain. We have to facilitate the participation of social partners to establish priorities, to assess health policies, and we will also include patients, and we have to reinforce the training of people regarding the promotion of independence, self-care, and healthy lifestyle. And we have to, of course, work with the caregivers. For all this, we also have drafted strategies to reinforce our plan. We have created a network of schools for citizens, and we're working on a global strategy for the promotion of health. In these schools, we consider that we will be able to work on training, health training for chronic pain. We not only have to take into account the pharmacological interventions, but also these sort of interventions. The network of schools for citizens will be the body where we will be able to see what sort of instruments are the most adequate, and to send messages of awareness towards these patients. We have a network of schools that will help us to do that. We also have prevention of health conditions and limitations. Obviously, we have to work to decrease the prevalence of risk factors. We have to work to decrease injuries and accidents that can lead to chronic pain. We have to early detect these patients with problems and that have a chronic pain, to be able to identify them, to intervene on them. And we have to carry on working on the improvement to not have complications, a lack of mobility, and any other interventions related to these sorts of patients with chronic pain. And this is adapted to the plan. We have to establish programs to promote the maintenance of functional capacity. We've talked about it during our discussion on indicators, a multidisciplinary approach. I've put here physiotherapists, but any other professional that could participate on this multidisciplinary team. We have to guarantee this proximity with the patients, and to create specific actions aimed to caregivers and to patients. We've seen it in the previous session, the role of caregivers, and it's a fundamental person that we have to take into account when we're considering patients with chronic pain. We have to work on the continuum of care. This is fundamental, is a line that we have to take into account. We have to take care of persons with chronic pain in the most adequate place. For some people, it would be primary care, and for other people, it would be a specialist. We have to identify properly which patient and which resource is the most adequate. It's not a war between primary care and specialists or between different specialists, but each specialist needs to participate to help the patient. Obviously, we have to have continuous care. We have to design strategies, avoiding duplication of intervention, and facilitate the transition among care levels. And we also have to continue to work at a health level and at a social level also, with objectives and recommendations. We're not talking about indicators. There's been a little controversy in the previous session. How can some indicators be considered as recommendations? So what we have to do is to reorientate our healthcare. We have to have a new approach to take care of patients with chronic pain. If we're talking about a plan for patients with chronic pain, we have to take them into account. For this, we have to identify each of the patients, and we have to take care of this patient in the adequate place. And all this to guarantee that the attention to these patients is effective, safe, efficient, evidence-based, and correct intervention for each level of attention. Obviously, the existence of manuals of clinical attention is something fundamental. We are drafting a guide of clinical practice for the pain management, and it will support this objective of the strategy. We also have to work on the optimization of the pharmacological therapy for patients with chronic pain. Another recommendation for the reorientation of healthcare, we have it here. We have to work on reconciliation of medication in care transition. We need to carry out a complete assessment, multidisciplinary and multimodal assessment. We have to define responsibilities. We have to define levels of training for the professionals that will intervene in this process, and we have to have models for each of the professionals that will intervene. And we can't forget that we have to work on the patient safety. We have to define safe practices and work with the patients in the rational use of medicaments, and this to minimize adverse effects. And there are the measures, non-pharmacological measures, that could help the patient. Obviously, what we've said before, this is a mainstream line, and all this needs to be based on health equity and equal treatment. I will not get into the details here. And all this plan needs to be based in innovation and research. Many of the things that we've said here, that sometimes we do not have surveys showing that. So we need to back research just to be able to take decisions regarding patients with chronic pain. So when we establish intervention strategies, strategies and when we use IT or new technologies that we can use to improve treatment towards our patients. Well, innovation, we also need to change the organization and need also to change the assessment processes. My message is very simple. To design a strategy on its own will be the basis to be able to work towards the attention of the patient with chronic pain, together with the regions and the experts, and to be able to talk about it in the governments, whether in the ministries or in the regions, if there are European regions with competence in healthcare. Thank you very much for giving us the opportunity to present our plan, and any suggestion that you might have, you have the address there on the screen. Thank you.